You are welcome to Living Agriculture with me, Luigare. I thank you for that short break, because what we needed to do as human being, we need at least to have a break and take some water. Then we come back when we are fresh. We left when we had talked about the diseases in chicken or in poultry. Now, we have what we call the viral diseases. Viral diseases, these are the diseases which have to be vaccinated. And after that, some are treatable. But what we need is you to identify, once you come across any disease, you should be knowing its sign, symptom, transmission, prevention, and the treatment. That's why we say that living agriculture is here for everybody. Number one, we have this disease which is called Marek. Some people write it like that, but it means the same. There is the American English and we have the British English, but the accent remains the same. This is Marek and this is Marek. Now Marek, it is a hatchery-borne disease. Let me remind you, I'm a deserted medical clinic officer. I deserted from medical after serving for 4 years. And the patients which were storming the health unit, they were not sick. You see, in all our employment, all our work, all service provision, we join them in 3 formats. 1, by choice. Number 2, by chance. Number 3, by force. Now, who is viewing? Where do you belong in your service delivery? Is it by choice? Is it by chance? Or it is by force? The best is this, because somebody who works by choice has passionate in what he's doing. 2, cares about his or her employment or service provision. 3, is ever free, is reachable, any that can listen. This is somebody who goes to that employment or profession by choice. Now, the one who goes by chance didn't have that profession or service provision from the bottom of his or her heart. It is just a chance. What you wanted, you fail. Then you go to side B by chance. Then this one by force. This is normally done by parents. I want you to be this. Or by friends. If you are my friend, you want to do this. You go by force. I need it to be open and sincere. Countrywide and worldwide, all security officers who went to security by force, these are brutal. They don't listen, they don't care, they don't understand, because they joined by force. And this one who joined by chance are money-minded. Either you are right or you are wrong. That's where bribery starts. By chance. Now this one who is there by choice listens and analyzes. I'm talking of security officers. And when I talk about security officers in Uganda here, whom I consider to be there by choice are the military officers, because their training and their overall commander talks to them. It is worldwide. Every military officer worldwide is understanding, unless the police officers who went there by chance and by force. I have to be open because it is me and this is living agriculture. You see, at times the truths are sour, but we need to talk about it. If it goes to the health sector, those ones who went there by chance, consultation 100,000 before even seeing the patient, before even taking the diagnosis, before even listening to the patient. Consultation fee first, it is by chance. Then by force, even if he or she sees somebody who is dying there, she may ask, is he or she the first to die? I compare all these two to other channels you view on living agriculture. They cannot give you everything you need to know, simply because once you get all the knowledge, you will not go back. But for living agriculture, we are here by choice, not by chance. And which forced me to desert from medical to veterinary, it was that the people who were coming at the health centers, their biggest problem was poverty, household income, unemployment. I said no, I should change the profession such that once we train these people to learn how to make money in a right way, to learn to create jobs, we shall, one, reduce the instability worldwide. Two, we shall reduce and prevent criminal activities. If somebody is busy on his or her farm, we don't expect these unnecessary riots. We don't expect unnecessary demonstrations. We shall be reducing robbery and theft if somebody is empowered to work. This is what living agriculture does. I was talking about Marek's disease. Marek's disease, it is a combination of all diseases from the farm. There is a Newcastle, which we call as NCD. There is infectious bronchitis, normally as IB. There is Gomboro, known as IBD. There is fowlpox. There is fall typhoid. Now, these ones here, we add coccidiosis. Once you combine all the viruses of these, you will come up to Marek's. I don't know whether you are following. Once we combine these, now Brian has a farm which has a Newcastle disease. Hannah has a farm which has infectious bronchitis. Ajati's farm has Gomboro. Then Marvin's farm has fowlpox. Once we bring all these eggs in one incubator, in the process of hatching, each farm will acquire the disease from another farm, from the incubator there. I think there you see. And as here, it is going to be Marek's. there is no one on this channel who have ever, I bet, ever thought about this. It is only on living agriculture. I assure you. It is not that everyone on living agriculture is a veterinary officer. 99%, no, okay, 98%, these are mere farmers and breeders, not veterinary officers. That's why most of them are arrogant. They don't care. There is only one sister, is called Arinda or Aringa. This is the one whom we share the same idea and understanding. Because she's over open and very free to give out what she does. But the rest, they are just there making money. And at times somebody comes and he wants just 50 chicks. And somebody says, I cannot sell 50 if you don't want 500. We don't have the same capital. We don't have the same infrastructure which can accommodate 500. We advise anyone who feels like going into chicken industry to use the money he or she has. As the process develops that, then enlarge and expand that farm. My fellow producers on living agriculture, please stop that arrogance of being rude to your clients. That if somebody doesn't manage to buy over 200, you will not sell these chicks to them. Remember, how did you start? 2, and where did you acquire this knowledge of breeding? 3, do you take time to train them before they take these chicks? 4, do you make a follow-up of the chicks you sold to them? Then if not that, please, in this world we are lives, anytime we try and fall, and we are here in the image of the Almighty, don't be proud of yourself.